Let's talk about colonoscopies. It's a procedure that allows your doctor to take a peek inside your colon and rectum to check for any problems, like ulcers, inflammation, bleeding, polyps, or even tumors. The tool they use is called a colonoscope. It's a thin, flexible tube with a light and a tiny video camera on the end. The doctor carefully inserts it through your anus, into your rectum, and guides it up through your colon all the way to the cecum, which is the beginning of your large intestine. Sometimes they can even take a look at the very end of your small intestine, called the terminal ileum. The camera on the tip of the colonoscope sends real-time images to a computer screen, so your doctor can see everything clearly. The tip also has a light, a way to flush water or air in to clean things out, and a channel to insert tiny tools like forceps or wire loops to remove polyps or take tissue samples, biopsies if they see anything suspicious. A colonoscopy usually takes about 30 to 60 minutes and is done in a hospital or clinic by a doctor who specializes in digestive systems, called a gastroenterologist. You'll be given a sedative to help you relax, and you'll lie on your side during the procedure. The doctor will carefully insert the colonoscope and move it through your colon. Since the colonoscope is flexible, it can navigate the curves of your colon. The doctor might gently press on your belly or ask you to change positions to help move the scope along. Throughout the procedure, you'll see a magnified, high-definition video of the inside of your colon on a monitor. This allows the doctor to thoroughly examine the lining of your colon. The video might be recorded, and they'll likely take some pictures as well. A small amount of air might be blown into your colon to inflate it a bit, which helps the doctor see better. This might cause some pressure or mild cramping, but taking slow, deep breaths can help. As the doctor slowly pulls the colonoscope out, they'll carefully examine the inside of your bowel. If they find any polyps or suspicious areas, they'll remove them or take small tissue samples to check for signs of cancer. Polyps are usually not cancerous, but they can sometimes turn into cancer, which is why they need to be removed. Since polyps don't have nerves, you won't feel any pain during the removal. After the colonoscopy, you'll rest in a recovery room until the sedation wears off. You might feel some gas or cramping, but that will pass quickly. Because of the sedation, you'll need a friend or family member to drive you home. It's best to take the rest of the day off and avoid making any big plans for 24 hours. Before you head home, your doctor will share the results of the colonoscopy with you. Now, let's talk about the 8 most common warning signs of colon cancer. Colon cancer is one of the most prevalent cancers worldwide. While it often develops without any noticeable symptoms, there are some warning signs your body might give you. These signs can be subtle or seem unrelated at first, but recognizing them early can make a huge difference. When caught early, colon cancer is highly treatable, and the chances of survival increase dramatically. So, understanding these signs and taking action is crucial for your health. In this section, we'll explore the 8 most common warning signs of colon cancer. While these symptoms don't always mean you have cancer, they're your body's way of saying something's not quite right and should be checked out by a doctor. Change in bowel habits. One of the earliest and most common signs is a noticeable change in your bathroom routine. This could be diarrhea that lasts longer than usual, constipation that doesn't get better with typical remedies, or a sudden change in the consistency or shape of your stool, like narrower stools. These changes might mean there's a blockage or narrowing in your colon caused by a tumor. While occasional bowel irregularities are normal due to diet or stress, persistent changes that last more than a few weeks should be taken seriously. Blood in stool. Seeing blood in your stool is always a red flag. It might look like bright red streaks or darker tarry stools, called melena, which indicate older blood. Blood in your stool can be a sign of colon cancer, as tumors in the colon can bleed. It's important to remember that other things like hemorrhoids or anal fissures can also cause bleeding. However, you should never assume it's something minor. Only a doctor can determine the cause. Abdominal pain. Persistent belly pain or cramping is another symptom to watch out for. This discomfort might feel like bloating, gas, or a constant ache in your stomach area. As a tumor grows, it can obstruct your colon, leading to pain or cramping as your digestive system tries to move stool past the blockage. If belly pain becomes frequent, severe, or doesn't go away with typical treatments, it's important to see a doctor. Unexplained weight loss. Losing weight without trying can be an alarming sign of colon cancer. Cancer cells use a lot of your body's energy, and the disease can interfere with how your body absorbs nutrients from food. This weight loss often comes with a lack of appetite and fatigue. While there are many reasons for weight loss, if you're experiencing it without changing your diet or exercise routine, it's a sign that something might be wrong. Fatigue, feeling constantly tired or weak, can be another sign of colon cancer. This isn't the kind of fatigue that goes away with a good night's sleep. It's a deep, persistent exhaustion that lingers. Colon cancer can cause anemia, which is a low red blood cell count due to slow bleeding in the colon. This depletes your body of oxygen-rich blood, leaving you feeling drained, lightheaded, and unable to focus. Tenesmus. Do you feel like you still need to go to the bathroom even after just having a bowel movement? This sensation, known as tenesmus, can be caused by a tumor in the rectum or lower part of the colon. The tumor can block the passage of stool, making you feel like you need to go even when your bowel is already empty. If this feeling becomes persistent, it's worth discussing with your doctor. Bloating and gas. Everyone experiences gas and bloating from time to time, but if these symptoms become chronic or unusually severe, they could indicate a deeper issue. Colon cancer can cause blockages in your digestive tract, leading to trapped gas, bloating, and a sense of fullness even after eating small amounts. If these symptoms don't improve or come with other signs like belly pain or changes in bowel habits, seek medical advice. Rectal bleeding. Bright red blood or discharge from your rectum is another warning sign of colon cancer. This might happen with or without bowel movements and is often mistaken for hemorrhoids. However, any rectal bleeding, especially if it continues, should be checked out by a doctor. While anyone can get colon cancer, some things increase your risk. Age. The risk goes up after age 50. Family history. Having a family history of colon cancer or polyps increases your risk. Diet. A diet high in red and processed meats and low in fiber is linked to a higher risk. Lifestyle. Smoking, heavy alcohol use, obesity, and lack of exercise also increase your risk. Medical conditions. Inflammatory bowel diseases like Crohn's disease and ulcerative colitis can increase your risk. Understanding these risk factors can help you take steps to lower your chances of developing colon cancer. It's important to remember that having one or more of these symptoms doesn't automatically mean you have colon cancer. However, these signs should never be ignored, especially if they last for more than a few weeks or get worse over time. Early detection is crucial. If colon cancer is found early, treatment is highly effective, and survival rates are much higher. Talk to your doctor about routine screenings, especially if you're over 45 or have risk factors for the disease. Regular colon cancer screenings, like a colonoscopy, are essential for early detection. A colonoscopy allows doctors to find and remove precancerous polyps before they turn into cancer. For most people, colon cancer screening should begin at age 45, but those with a family history or other risk factors might need to start earlier. Colon cancer is a serious disease, but it can often be prevented. Recognizing the warning signs like changes in bowel habits, blood in your stool, belly pain, and unexplained weight loss can help you catch it early when treatment is most effective. If you notice any of these symptoms, don't wait. Schedule a visit with your doctor and discuss your concerns. Being proactive about your health could save your life. By staying informed and vigilant, you can take charge of your health and significantly reduce your risk of colon cancer.